What is the salary one can expect after completion of MD Dermatology?
In SRship, you can get somewhere between 1 to 1.5 lakhs per month. For assistant professor, you can get between 1.5 to 2 lakhs.
Why did you decide to take dermatology?
So it's a real nice blend of surgical and medical branch.
How the residency in dermatology is like?
I think the departments function in a pretty similar way as other specialities. There is nothing very special about it.
And how essential is doing SRship after completion of your PG?
In dermatology, this is a problem. There is paucity of seats for SRship. For every 3 to 5 PGs, there are 1 to 2 seats. So the ratio is not very good.
What is the difference between doing MD Dermatology and DNB Dermatology?
I do not think that MD or DNB degree makes a difference if you are well versed with your clinical knowledge.
How to start a dermatology clinic and how much investment is required?
You can start all those basic things in 3 to 5 lakhs as well. If you just need to start a very basic setup and it works well for your tier 2 or tier 3 city.
Many of the teleconsultation companies are now offering dermatology consultation fees as low as 100 to 150 rupees.
The basic owners of such services are businessmen. So they don't see doctors as doctors, they see doctors as a revenue generating machine.
Would you recommend anyone taking dermatology in 2025, especially how the cosmetology and aesthetics is evolving and there is saturation?
If you are really passionate about the subject, seeing patients, seeing OPDs, doing minor procedures, getting excited about it, then you should opt for dermatology, no problem.
Hello everyone, I'm Dr. Rahul Chawla. Welcome to episode 13 of NEET PG Mentoring Sessions. Today we are going to discuss about future scope of dermatology with Dr. Diksha Aggarwal. She did her MD Dermatology from RML Delhi and right now she is working as an assistant professor in Venkateshwara Institute of Medical Science. She also has her own dermatology setup and she's also associated with healthpill.com as contributor and mythbuster. Welcome Dr. Diksha. So glad to have you here.
Thank you, sir.
So, Dr. Diksha, starting with our usual line of conversation, why did you decide to take dermatology?
Sir, a lot of people think that it is an emergency-free branch, a chill branch. That is what people think also while they're taking. So my perspective was a little different. I wanted to do something related to a subject medicine, but not primarily medicine. So some subject related to medicine. So I had narrowed down to pediatrics and dermatology. But while I was in my internship, I realized that dermatology has much more to offer than we know because we're not very exposed to dermatology during our MBBS. So when I was in internship, I came across a lot of minor procedures which are quite interesting and just limited to dermatology. So it's a real nice blend of surgical and medical branch. And if we would discuss further, basically dermatology itself has a lot of sub branches. So it had a lot to offer, much more than we got to know during our MBBS. So I think that is what prompted me to take dermatology. It was a blend of really the medical thing and the surgical thing and the combination of both the things. So I think that worked well for me.
Yes, of course, and that comes with good monetary compensation and good work-life balance. It's a chill branch, not much of emergency, and had a great scope at least 5 to 10 years back. But now, as I believe, some things have changed, and we are going to discuss more about that. So, when we talk about residency, how the residency in dermatology is like in terms of work-life balance, toxicity, inner functioning of the department.
So I think the departments function in a pretty similar way as other specialities. There is nothing very special about it. We have our OPDs, we have our OT postings, we have them in rotation, we have our ward postings. So similar to what we used to have in other subjects, other departments. So similarly like that, it was a rotational thing. Toxicity is a very subjective thing, I would say. Some people can have toxicity in dermatology also, in a other chill branch, which is considered radiology also. But I think it depends on the department. Few days can be tough, few days are nice. So I think that's a very variable question. But otherwise, work-wise, it is very, very, it's distributed equally amongst the ward patients, the OPD patients, and OT patients. So I think it was a good work-life balance, even in residency. Emergencies, rarely we used to have, especially for ward patients, or some patients used to land up in emergency sometimes. Not as much as medicine, of course, or surgery, of course. Wouldn't compare to that. But I think otherwise it was not so toxic and not so heavy on the work. A lot more on the studies, I would say, compared to many other branches. But work-wise, it was balanced.
In private practice, a lot of cosmetology aspect comes into the practice in dermatology. But cosmetology aspect is covered during your residency training as well.
It's a very thin line between what we considered as aesthetics. Cosmetology is a very quacks sort of use it. But what we actually like to call it is aesthetic dermatology. So I'd like to say it with an example. So a patient with acne, he would have medical management of acne, and also he would need a certain surgical amount of treatment for that. So I think the aesthetic dermatology goes along with core dermatology is what I'd say. So all those things we are taught in residency, that is for sure. But if you're talking about purely aesthetic procedures or cosmetic procedures, those are not promoted so much in medical colleges, and I think rightly so, because the focus is more on the the core dermatology or the practical dermatology more than the cosmetic dermatology. So that is there. But otherwise, we get a decent exposure. There is exposure to all kinds of lasers, cauteries, RFs. So all those procedures, peels. So we do used to we used to do all these procedures in our minor OT postings. So all those things are covered. But if you talk about purely aesthetic procedures or injectables like fillers, so these are not promoted so much.
So all these facilities, especially in terms of lasers and whatever interventions that are required, do these modalities are present in all the institutions? And if I have to turn this question in a different manner, while choosing a particular institution for dermatology, what points should an aspirant keep in mind in terms of the modalities that are available and the facilities that are available so that the learning is adequate?
So, according to NMC guidelines, all institutes, whether private or whether government, they are supposed to have certain lasers. That is a prerequisite, that is a requirement. But a lot of places can have dummy kind of things, and they may not have, they may show in the inspections, they may not have, or they may not be in the working condition. They are just for the presentation purpose. So, what you can do is you can ask your seniors, you can ask people who are already studying there or working there if the institute is actually worth it, if the patient load is good enough that you actually get hands-on on it, or do you have access to these, because a lot of places the faculty only gets to do them, so the student does not get to learn. So you get to know all these things when you talk to your seniors or people who are already working there. So based on that, I think you can help in deciding the institute. Many institutes do not favor procedures, that is also there. So you need to know it beforehand. You can ask the seniors, and rest I think uh, it can be guided by other people who have already passed out from the institute. So those people can help you out with this.
And how essential is doing SRship after completion of your PG for dermatology?
I think SRship is quite helpful because in PG we are just assimilating the information. We just get to know, we get to see different kinds of cases. We are learning every day. We are reading every day based on that, and we are assessing what the faculty did to that patient. But I think post PG, once you're done with your exams, you are a little less stressed out. So you get to apply that knowledge. You are helping. You're teaching PGs. You're guiding. The patients, you are under the faculty, so you're still learning, but you have gathered a basic knowledge and you're teaching and you're seeing patients. So I think all of that really makes a lot of difference. So I think you should give uh, 3 years to your SRship to gather more information, to gather more knowledge, to practice that before stepping out into the big bad world, so that you are more equipped to deal with the patients outside. So I think it really helps. It is important.
And how easy is it to get the SRship from good institutions or institution of your choice or your institution wherein you did your post graduation?
So, in dermatology, this is a problem. There is paucity of seats for SRship. That is there, especially in government institutes. For every 3 to 5 PGs, there are 1 to 2 seats. So the ratio is not very good. Uh, what you actually can do is, if you want to do SRship, you can. There are a lot of private medical colleges which are opening up, or non-academic institutions which are there, which do not offer a teaching experience, but nevertheless, the patient load is quite much. So what you can do is you can practice there for 1 to 3 years at least after PG, and you can get the similar kind of exposure from there also. You may not get the proper government institute that you're talking of. In case you do, it's very good. But in case you do not, I don't think that's the end of the world. You have many other options to continue SRship also.
What is the difference between doing MD Dermatology and DNB Dermatology? And which are the institutions that should be preferred in case you are opting for DNB Dermatology?
So this question has been coming up since many years. People always, especially in India, it's a norm that people think that MD is superior to a DNB degree. Uh, I think it matters only in your head till the time you're there in the institute. After you step out into the practice, I do not think that MD or DNB degree makes a difference if you are well versed with your clinical knowledge. So, even if you're doing DNB and you have a good clinical knowledge, I think you're good enough to treat patients, and it does not really matter if you're doing MD or DNB. If you're doing MD from a poor institute where the patients are not there, the faculty is not teaching, versus you are doing your DNB from a very good institute, good patient load, good teaching material. So I think DNB would be better in that scenario. You just need to be polished for your future, for your rest of your life. So I think it's a very small stepping stone towards your much larger race. It's a marathon, not a sprint. So I think MD or DNB is equivalent. Uh, Coming to the second part of your question, sir. So I think DNB institutes, again, you need to do a background checkup. All the good premium institutes which are offering DNB with good patient load in cities such as Delhi, Mumbai, and central cities, even otherwise in tier 2 cities, there are many good institutes which offer DNB. So I think those can be preferred in case you're not getting MD in a good institute and you want to really take up dermatology. So I do not think that should be a deterrent if you get DNB and not MD.
And ultimately, that depends on the caseload, the variety of cases that you are getting, the modalities that you have, and how is the department functioning, and obviously the academics. So, if a good DNB institutions has all of it, definitely it's a good thing. Definitely it's worth taking DNB. However, there are many private medical colleges and even private hospitals which offer DNB in various subspecialties and specialities. However, but the functioning of department is not that adequate. The caseload is not good. Not many modalities are there. So that you have to look into. And before making a choice, do a background check of the institution, be it government, especially in tier 2 and tier 3 cities, or a corporate hospital. Are there enough vacancies for job as an assistant professor in government medical college in dermatology? And how easy or difficult is it to get APship in a good government institutions like AIMS, PGI, or other good colleges?
So, in very good institutes like AIMS, PGI, or top premium government institutes, it is quite difficult. It is through the government exam, and it can take many years for you to grab that seat. So, practically speaking, it is very difficult. People do get it, but the seats are quite limited compared to the PG seats. So, gets narrowed down there. So, people who want to enter academics either can go through the government colleges, or else you don't want to wait that much. Private medical colleges are opening up. A lot of them are currently there. So there, if you have an experience of 1 to 3 years, in many places like Delhi, we need SRship of 3 years. In many other places like Uttar Pradesh, you need SRship of 1 year to apply for APship. And I think there it is a little easier to get a AP seat if you have availability compared to the government seats. Because in dermatology, the seats are less, that is for sure. So if you want to enter into a medical teaching line, if you have set your goal towards that, so I think that is another option. You can enter via the private medical college. And in case of vacancies, whenever the vacancies arise, you can always switch. So that is always an option.
What is the salary one can expect after completion of MD Dermatology in corporate hospitals in tier 1 cities, or private hospitals in tier 2 and tier 3 cities, or even the various dermatology clinics that have sprung up now in metros and even tier 2 cities?
Okay, so if we talk about hospitals, in SRship, you can get somewhere between 1 to 1.5 lakhs per month. And in for assistant professor, you can get between 1.5 to 2 lakhs. That is for private hospitals. Then there are non-teaching medical colleges or hospitals. So there you can get similar to what government offers without the teaching experience. So that also is roughly 1 to 1.5 lakhs for SRship and 1.5 to 2 lakhs for APship. Uh, if we move our stream towards corporate hospitals, so there are many uh, there are many private corporate institutions or aesthetic institutions which offer a lot of aesthetic practices. So there the starting salary can be quite low. So they have a mixed model. So you can have a starting salary of 60-70,000 per month, plus you have an incentive basis based on the number of procedures you do. So as you become more proficient, your salary increases. It can go up to 1.5 lakhs. So that is what you can do. Apart from that, there are hair transplantation clinics. So there also the salary varies between 1.5 to 2 lakhs, and they many of the institutes are ready to take freshers or people with experience of 1 to 2 years also. So that is also another exciting option which has come up.
When we talk about corporate hospitals, how is the trajectory like? Like, how many years does it take for somebody to become an associate to fully fledged consultant in a private hospital? Or even in case of dermatology clinics, if you join in as a consultant with a salary of 1 lakh to 1.5 lakhs, in how many years you can expect to get a good salary of 4 to 5 lakhs?
So, if we have a hospital-based setup, if you are in a college, so then the escalation is similar to what happens in a government medical college. Uh, that is, you go via the assistant professor, associate professor, and professor. So once you become professor, the salary can become roughly 4 to 5 lakhs per month. But if we go, what most of the dermatologists take the route of is of a corporate hospital or as visiting consultants in hospital. So that there the scenario is quite different. In corporate hospitals, you can either be employed as a full-time consultant. You may be working for 6 to 8 hours. So there you get a fixed salary model for most places. Or a lot of hospitals, what they do is they call the dermatologist for a visiting mode. So you're visiting there for 2 to 3 days a week or a few days a month. So it's specified. So what they do is they give you a per patient kind of payment. So that can be divided like 70-30 or something like that. The ratio is there. So there the escalation is not so much. You get the amount of patients you see, you get as much as you are seeing. So there you don't get a proper escalation like you do in other subjects, that you become a junior consultant or you become a senior consultant. So basically you're just there. For most hospitals, there will be 1 or 2 dermatologists only. So it is not headed by one person and team. It is mostly independent in corporate hospitals. All the doctors who visit, they see the patients independently, follow up the patients independently, and get their pay based on the patient-to-patient basis. So escalation per se is not so much. It just stagnates after a while.
I think one of the reason is that, in dermatology, you don't have much admissions. Neither you have admissions in ICUs. In fact, many of the even big hospitals, they do not have a functioning department per se. They would have OPDs, but they might not have inpatient departments. And many hospitals, they keep dermatologists only as visiting consultants. So because you are not generating enough revenue, you are not doing procedures over in the hospitals. Obviously, they won't be hiring you at fixed salary basis. They would be keeping you at as a visiting consultant. So I think that is why it becomes very important that you have your own clinical setup in dermatology.
Absolutely correct, sir. So once you have decided that you want to enter the private route, so what you can do is you can start up with the corporate setup, but eventually you will have to open your own clinic because that is how you establish your name and you gather your patients gradually. Because the hospitals will have a lot of limitations. They will not let you do certain procedures. They may not have the lasers because most of the hospitals will have a multi-speciality kind of working environment. And as you rightly said, the inpatient is not there in dermatology. In hospitals, we do see, but it's very rare in corporate setups. So mostly the dermatologists thrive on OPD. So gradually for the procedures and gradually to establish yourself, I think your own setup is important, and gradually people work towards that. That is how you grow in dermatology.
How to start a dermatology clinic and how much investment is required?
So opening your own clinic, it's a very big decision. So you need to see in a lot of factors, where you are opening, the city you are in, uh, a lot of other factors like parking space and all those things are important. But when we just come purely to the investment point of view, I think awareness of a dermatology clinic matters. So in tier one cities like Delhi, Mumbai, people are a lot more aware about the procedures that happen in dermatology clinics. So you may not just be okay with opening a very basic clinic. You may need infrastructure and you may need instruments from the starting. But if we move towards tier 2 and tier 3 cities, where we have a more mixed practice, where we have the patients are less paying to say per se, and they may have a little more clinical kind of problems. So there we can start how we start a medical setup or a medical OPD. We need to have a basic setup, basic infrastructure, OPD, all those things. Apart from that, few basic machineries are good enough to start with. For example, you need a good pottery, you need few peels, few medicines, few few instruments which are needed, suture materials and all those things. So I think rent apart, you can start all those basic things in 3 to 5 lakhs as well. If you just need to start a very basic setup and it works well for your tier 2 or tier 3 city, you can just start with that. What actually you can do is you can gradually build up your patient base, see the kind of patients that are coming in. If you have a little more clinical practice, you can bend towards that, get instruments related to that. If you have a little more aesthetic practice or patients are more inclined towards procedures, you can gradually start investing in lasers. Lasers also, we have multiple types. So you may have a laser hair removal laser, depending on if you have a lot of patients for that, or a pigmentary laser. So you may not need to buy all the lasers and invest 50 lakhs or 1 crore at one moment. You can gradually choose which is your patient base, what do they want, and then invest accordingly. So you can gradually build up your base and gradually start investing. And that is another way that you can establish, because not everybody can start with a 1 crore practice. And I think that is how you gradually build up. You can start investing in one of the lasers. Another option is you can rent lasers, or you can rent some of the machines. So that option is always there. So you don't need to do a big investment right away. You can just hire the lasers. You can do for some patients, see the results, and then gradually move up. I think it's every day you move one step ahead. So I think that is how you can gradually scale it up also.
And how do you go about marketing of your clinic?
So marketing is very important these days. So digital marketing has really come up. I think in all specialities it is important. You have to be visible. So a lot of these companies, they come up. They offer digital marketing services. They show up your ads on Google and your ads on Instagram. So I think it depends on your practice, area of practice. So they start increasing your base according to that. But I think in long term, word to word, the patient who come via that, I think that is the best kind of patients. But you need to be visible on Google and Instagram. I think those are things which people see these days. They see the reviews, they see how well you are doing, what are your before afters. I mean, we are in a time zone where people are influenced by all those things. So I think you can invest some amount in your digital media and marketing also. So that helps. Definitely that helps.
How are these cosmetologists and aestheticians affecting the practice in dermatology? There are many such aestheticians and cosmetologists who have sprung up. They might not even have an MBBS degree. Many of them are even BDS. And in fact, recently there was a case wherein a hair transplantation was done by a BDS graduate who was posing herself as a dermatologist. And we have so many influencers who are calling themselves cosmetologists. They have lakhs of followers and they have a huge patient base as well. Many of them have opened their own aesthetics clinic, and many of them are in fact teaching aesthetics. So how all of it has affected dermatology practice, and how is the future in dermatology going to be?
So yeah, this is the grim reality. A lot of quacks are coming up. It's probably because they see aesthetics as easy job, easy money, and glamorous. So a lot of such people are coming up. You rightly saying, sir, that many of them are not even MBBS. They're just plain BDS, or they're just BMS, BHMS. So they're not even doctors in allopathy. So they do not know anything about core skin knowledge, about core dermatology. They're just there to exercise what they have assumed or what they have learned. Many of them have started their career as assistants to dermatologists, and then they start their own clinics and all sorts of things, all sorts of knowledge is available. And they just make very nice reels and very nice content and they become famous. So that is a grim reality. It is coming up. And what we can do is but what we actually also see is they show their good part only, but we see a lot of cases which are destroyed by them. As you were saying, that really bad case of hair transplantation, in that the poor patient had to give up his life. But for most cases, even if not so grim results happen, they do burn up the faces. They do a lot of skin reactions, which is beyond their treatment protocol, and then they send to dermatologists. So a lot of good side to it, bad side to it. People eventually are realizing that a lot of it is wrong. Many patients do come to tell us that uh, uh, this random parlor auntie told us to try this hydrofacial, or this random neighbor told me to try this, or some random influencer I bought this, but it caused me burns or it caused me problems. So they although it comes a little via loop, but they do come to dermatologists eventually. So our place is not lost. It's just that it gets, the patient doesn't come to us directly. They go via these people sometimes because they come up more in their feed or whatever. But after facing the consequences, they do come back. So I think all is not lost, but definitely they do dilute the practice a little. I agree.
Has dermatology as a branch got saturated in these years?
So saturation, again, we say because we see a lot of influencers, a lot of people posing up as dermats who are not there. But to talk of the number of dermatologists in this huge country of 1.4 billion people, more than that, we have 18,000 dermatologists registered, which is not that much. So I think it is not getting saturated, just getting seen a lot more. A lot of it, everybody poses to be an expert. They want to talk about everything. They tried something which worked for them and they want to talk about it. So saturation is something which I don't see. It is more so infiltration from such people. That is one thing. And number two, dermatology itself has a lot of sub areas of specialization. So a person can specialize into hair, so trichology, more into hair transplants or hair regrowth things, or more into aesthetics, or more into surgical. So there are a lot of vitiligo surgeries, even cancer surgeries, skin cancer. So a person may specialize into that. So I think saturation is not something we still are in dearth of core dermatologists. The problem is a lot of aesthetic people, they overpower and they get seen a lot more than the core dermatologist. So saturation, I would not say, but I would say yes, the aesthetic parts is getting a lot more overboard compared to other specialties. That is it.
What are the different fellowship options in dermatology, including 1 or 2 year fellowship in institutions, also short-term fellowships, and also fellowships abroad?
So there are areas such as pediatric dermatology, or dermatopathology, or surgical aspect. So in all those things, procedural dermatology, hair transplantation, lasers. So you have observerships and fellowships in these things. The parent branch IADBL itself offers observerships, scholarships for that. That could be as little as 1 month or 3 months, or a few institutes they offer for a year or 2 years. So there are fellowships for that. You can opt for procedural dermatology or pediatric dermatology. Abroad, again, similar kind of specialities are there in dermatology. Derm path there is very important, or oncology part in dermatology is very important, where you get more skin cancers abroad. So those fellowships are being done abroad. So those can range from 6 months to 2 years also. So those are options which you can apply. Few via scholarships, or few via you can give exams for those, and those are another option if you want to specialize in a particular field.
Does having a fellowship gives you an edge in terms of salary, especially in corporate hospitals?
See, in corporate hospitals, you will have all sorts of patients. You'll have a mixed bunch. So you can't say you have a particular specialty, and you will just treat that. That becomes a very later kind of step. So you have to see all kinds of patients. So a big salary jump is not what you expect out of these fellowships. It's more out of interest, and also if you want to be associated, suppose if you are into an academic kind of fellowship, so there are certain institutes, certain hospitals which are for children only. So there, a pediatric dermatology fellowship definitely helps. Or a few hospitals in South have a special unit for that. Or if you're into surgical, so there are few institutes which offer more surgical, but especially in corporate you don't have a specialized setup for dermatology. You have few lasers and few OPDs, so I think it's a mixed bunch, so it does not hike your salary so much. But depending on where you want to go with that, so if you do a fellowship in procedural dermatology for 3 months or 6 months, let's say, so it does enhance your clinical skills. So if you open your private clinic and you have a better clinical skill, the patients will, of course, the inflow will increase. So that way the salary, I mean, your income increases. So that ways it can increase, but not per se in corporate. Don't think so.
Many of the teleconsultation companies are now offering dermatology consultation with fees as low as 100 to 150 rupees. So, how do you see what is happening and why are doctors actually agreeing to see patients at such low rates?
So many times they are dermatologists, many times they are quacks posing as dermatologists. So for those people, number one, bulk matters. The people who are providing these services, the basic owners of such services are businessmen. So they just want more revenue and less, less income to give to the people. So they don't see doctors as doctors. They see doctors as a revenue generating machine. So they would want to pay them less. Uh, and they may not be dermatologists, as I was saying. Again, a lot of people don't know the distinction between a dermatologist or these aestheticians. That is a sad reality. So they may pose the other specialty people, or the non-qualified people may pose like that, and they may agree to do on such low rates also. A qualified personnel would not should not agree to work on such low wages, I would say. Also, these companies have a model to sell medicines. So their primary aim to attract customers is to just attract on a low OPD basis, and they just want to sell their medicines and gain a lot of profit. That is how these work. So they really do not care about the doctors or the patients. So I think these models are just revenue generating for them. They do not. They should not hold a lot of place in society, because these are not patient helping at all. The doctor does not give them time. They do not try to understand the situation. A person who is giving 15-20 minutes and they've studied for 15 years and they're just taking 150 rupees, I don't think they will listen to you a lot, or they'll solve your problem very much. So I think the quality or quantity, you have to choose.
Would you recommend anyone taking dermatology in 2025, especially how the cosmetology and aesthetics is evolving and there is saturation?
So I would say that if you are really passionate about the subject, if you do your background check and if you're passionate about all these things, seeing patients, seeing OPDs, doing minor procedures, getting excited about it, then you should opt for dermatology, no problem. But if you just see the glamour, you just want to see that it is involving a lot of good aesthetics, nice people, all those glammed up people. So I don't think that is dermatology. That is a very uh, glammed up picture of dermatology. It is not what dermatology has to offer. So a lot of clinical dermatology does have a place still. That portion is not saturated, as I was saying earlier also. In tier 2, tier 3 cities, we still have a lot of demand for dermatologists. A lot of people, MBBS people are there as MO levels, and they really treat skin diseases bad. When these poor patients get referred to us, there we see that their poor plight, and we see that how badly they've been managed so far. So I don't think core dermatology is still saturated. There is still a lot of scope. But if you think for aesthetics and if you just see the glamour world, I think there that is a problem. You will not be happy once you enter. You'll have to see a different world which you were not prepared for, and you may face saturation. That is there because quacks or no quacks, these people do pose up and they will pose a competition to you. So that is there. So you need to choose your priorities. And that is what I would say.
So crux of the matter is that there is no easy money unless and until you have your own setup. So take that fact into account before choosing the branch. Thank you so much for your time, Dr. Diksha. It was a great session and I hope students would really like it and that would help them take an informed decision before choosing dermatology. Thank you so much for your time.
Thank you, sir. Thank you for having me.